Professor David Ralph. I work in London at the University College. The only way you can build anything, you're not going to build it on your own. You have to appoint good people. You're not going to appoint people that aren't going to cause any problems. You have to appoint people who you think are going to make the unit better.
So good to meet you, sir, in Saudi Arabia, Riyadh. Could you please introduce yourself?
Yes, I'm Professor David Ralph. I work in London at the University College. I've been a urologist for almost 30 years now, and I specialise in the field of andrology, so that's male sexual dysfunction, penile reconstruction and male infertility.
So, as we all know, you have successfully grown and established Andrology in London and I guess all over the UK. So may I ask why did you start to work as Andrology in the first place?
I was training as a urologist like we did 30 years ago, and as part of the training one had to do a year's worth of research, and so I was hunting around trying to find out what project I could do, and I happened to stumble against to my mentor John Pryor, who said, "Oh, I have a project on Peyronie's disease, and if you want you can do that." So I said, "Okay, fine." I went and found out what Peyronie's disease was, and that's what I was going to do. So I did that for a year, both in the lab. I got a higher degree in Peyronie's disease. Usually what happens is that the research that you do, you spend so much time, you become known in the field, and then eventually I was the andrologist, particularly when John retired a few years later.
When I went to get a training from you in London, I was able to see you created a huge, almost gigantic a practice which involves a lot of fields. Every field of andrology, I'll say, and also you have a whole lot of crowds all over the world.
It's quite satisfying to see the department grow, because I mean I started 1996 as a consultant and it was just myself, and then I managed to get a nurse practitioner, and in the field of erectile dysfunction, anything to do with andrology, the patients suddenly keep coming, and I was finding that I couldn't cope, and so I needed a colleague. So the hospital realised that was the case, and so they gave me a colleague. And what happens in andrology is there's an endless number of patients. And so even though you have a colleague, that colleague makes just as much work, and so you need another colleague. And so it went like that. And so currently we have 6 andrologists in UCL. And because there's 6 of us, we then said, well, we can't all just be general andrologists. Why don't we subspecialise? So I mean, we all do everything. One's doing male infertility, 1 or 2 are now doing penile cancer, one's doing phalloplasty, and I'm doing obviously the penile implants, Peyronie's. We do everything. We also do gender reassignment, and we have 6 full-time consultants. We now have 8 clinical fellows, 2 nurses, and you can see that it's actually becoming quite a big department in its own right.
I felt like it's a kingdom, full lot of difference in terms of andrology.
You've got this big department, but there's still a wait to see us. I guess success brings success, and it's nice to see, because obviously you have to throw the gauntlet down, and someone else will have to take this up, and hopefully we will continue expanding.
What I wanted to ask you is that not every surgeons are like yourself. For example, there are many surgeons who I call as infertile in terms of offsprings, not the children, but their colleagues, I'll say. They do not tolerate well with the colleagues. As a surgeon, we want perfection. How were you able to overcome that and train? I saw you how train the other trainees. You let them do the surgery, even though trainees are not as good as you, but you were letting them learn the.
I've always, obviously there's confrontation between colleagues, but at the end of the day, the only way you can build anything, you're not going to build it on your own. You have to appoint good people. You're not going to appoint people that aren't going to cause any problems. You have to appoint people who you think are going to make the unit better. I think we must have trained in the UK 30 or 40 separate andrologists who've then gone out to the different areas and set up their own practice. For example, Scotland will say, well, we haven't got any, so we have trained someone who we know is going to go to Scotland, Northern Ireland, Wales, and all different parts of the country, because it's much easier if you know someone is coming from an area and they're going to go back to that area once they've been trained, because they can't all stay in London. But so we get lots of referrals from all areas of the country, but of course the more you train people, they can then do the cases themselves, and so you get less referrals. But you know, as I said, andrology is a field where there's just you're never short of patients, and be it private patients or NHS patients, don't worry about it. If you're good and you have a good service, patients will find you.
I guess that's the key. You know, as you are providing patient a good service, that's why you have an endless patients. Because as you know, I need a lot of education, so I travel several other countries and seen many other surgeons, but not everybody was speaking the way you said, the way you just like you mentioned. So they are lack of the patient, they are crying for more cases, but I believe I totally agree with you. Over the years I've seen, it is the patient who decides where to go, and if they know that if the surgeon is trustworthy, they will always come to you and get the proper service. So I guess when I was sitting at your outpatient office, I was able to feel the patient was referred, and I don't trust that you don't have enough referrals, because I was able to see a lot of referrals from the other surgeons who trust you, and the patient had a complete trust of your presence.
I think you have to develop a doctor-patient relationship. I think you have to be kind to the patient. I mean, there's a lot of doctors, you know, when they're just not interested. I mean, you've got to be interested. So if you're a general urologist and someone comes in with erectile dysfunction, you know, you're not as interested perhaps. And I think the more interested you are in a subject, then obviously the patient realizes that you can just relate to them pretty quick. You know what their problems are and how they're feeling, because you know, it's all areas. There's a lot of psychology in andrology, and I know what issues they're concerned about.